So if you're gay, is it possible for you to change your sexual orientation, say become straight through some kind of therapy?
Absolutely not. All of the data I've seen suggests that it's not possible. I mean, I think that people can change their sexual behavior. They can choose how they want to express their sexuality, but I think their underlying patterns of sexual attractions will always remain. If they're gay, sexually attracted to men. And the American Psychological Association, American Psychiatric Association have come out very firmly stating that therapies that are aimed at changing sexual orientation are not effective and also have high potential to cause harm. And so, as a clinical psychologist, it's a tricky issue when you have somebody who, for personal or cultural reasons, can't express their sexuality, their same-sex attractions, and are seeking some way to have a more harmonious experience of their sexuality and their culture. But really, I think that's a point where you can educate people to understand that same-sex attraction is part of the sexual variation that we see, and what needs to shift are the attitudes towards it, not that individual's sexual behavior.
So the public or the society's
Yes.
response to people who are gay
Absolutely.
is what needs to change, not the individual.
Absolutely. And so, very recently I had a student come to me whose family had taken him to an Exodus meeting, so an organization that's sort of aimed at changing sexual orientation. And aside from educating him about the organization and how ineffective this is, encouraging him to try to educate his family as well, and to get them to begin to explore the possibility that if they encourage their son to do this, there's a high probability that he's going to be harmed by it. Mm-hmm. And I don't think that's what any parent ultimately wants for their child.
But what would you say to a parent who has a gay child and is wondering whether it's possible for them to change their child's sexual orientation?
I think I would first start and tell them that there is no evidence supporting these forms of treatment, and that they have high probability of causing harm. And then work to educate parents to understand, sexual variation, and also try to work with them to understand where their concerns and their biases and their homophobia is coming from, and is there a way that they can work to resolve that so they can have a better, more supportive relationship with their child.